Have you ever stopped to wonder if the pills you take every single day might actually be harming your heart? I'm talking about the medications so many seniors trust without question. Medicines that could be silently weakening your heart without you even realizing it. Hi, my modern and unstoppable seniors. Welcome to Wellness for Modern Seniors. After spending years connecting with countless seniors across the US, I've noticed a troubling pattern. Many experience chest pain, shortness of breath, or sudden fatigue, and surprisingly, the root cause isn't always aging or stress, but often the very pills they've trusted for years to protect their health. Today, I'm going to share with you the 7 most dangerous pills that millions of people over 60 take every day. Pills that can quietly damage your heart health over time. This isn't just about scare tactics. It's about empowering you with knowledge to protect your heart and your life. You need to watch this video all the way through because one of these pills might already be in your medicine cabinet, and knowing the truth could make all the difference. Before we dive in, if you find this video helpful, please hit the like button. It really helps us reach more of my modern and unstoppable seniors who deserve to know this. If you haven't subscribed yet, I highly recommend you do so and tap the notification bell so you never miss life-saving updates like this. And hey, if this video resonates with you, comment number 1 down below to let me know. If it's not quite hitting the mark, comment number 0. Your feedback means everything as I strive to bring you the best advice for your health. Now, here's a quick preview of what we'll cover. 7 pills commonly prescribed or bought over the counter that may be doing more harm than good to your heart. From painkillers to diabetes meds, blood pressure pills, and more. Understanding these will help you have informed conversations with your healthcare provider. So, let's get started. Pill number 7 is one of the most commonly used, but also one of the most underestimated when it comes to heart risk. Pill number 7, non-steroidal anti-inflammatory drugs, NSAIDs. Chances are you or someone you know uses NSAIDs regularly. These include popular over-the-counter medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and even aspirin at higher doses. They're the go-to for many seniors managing arthritis, joint pain, muscle aches, or back discomfort. But here's the catch. While NSAIDs reduce inflammation and ease pain, they can also quietly put serious strain on your heart. How? By causing your body to hold on to sodium and water. This leads to fluid buildup, and that extra fluid means your heart has to work harder to pump blood. For seniors, especially those with aging or weakened hearts, this extra strain can tip the balance, increasing the risk of heart failure, irregular heartbeats like atrial fibrillation, and other cardiovascular problems. NSAIDs don't stop there. Prolonged use can damage your blood vessels and kidneys. Your kidneys play a critical role in filtering waste and regulating blood pressure. When they're compromised, your heart feels the pressure. Literally, if you're on medications for blood pressure like ACE inhibitors or diuretics, NSAIDs can interfere with their effectiveness, making your heart work harder without you realizing it. Because these meds are easy to buy without a prescription, many seniors assume they're safe for daily use. But remember, accessible doesn't always mean harmless. If you need pain relief, safer alternatives exist, like acetaminophen, Tylenol, or non-medication approaches such as physical therapy and gentle exercise. Always check with your healthcare provider before taking NSAIDs regularly, especially if you have heart or kidney issues. Pill number 6, thiazolidinediones, TZDs, diabetes medications. For seniors managing type 2 diabetes, TZDs such as pioglitazone, Actos, and rosiglitazone, Avandia, might be familiar names. These drugs work by helping your body use insulin, more effectively to control blood sugar. But here's the risk many don't know about. TZDs can cause your body to retain extra fluid, leading to swelling or edema, especially in your legs and ankles. This fluid buildup puts additional pressure on your heart. For seniors, this can be especially dangerous because it raises the risk of congestive heart failure, a condition where the heart can't pump blood efficiently, leading to fatigue, breathlessness, and swelling. If you or someone you love takes these medications, it's vital to watch for signs like sudden weight gain, swelling, or shortness of breath, and to discuss these risks with your doctor regularly. Managing diabetes is important, but so is protecting your heart. Sometimes, there are safer alternatives or adjustments to your treatment plan that can help you keep both your blood sugar and your heart in check. Pill number 5. Certain blood pressure medications with hidden risks. Many of you might be taking blood pressure medications to keep your numbers in check, and that's great. But not all blood pressure meds are created equal when it comes to heart safety in seniors. Some older classes of blood pressure drugs, like certain beta blockers or alpha blockers, can sometimes cause side effects that impact your heart rhythm or lower your heart's efficiency. While these meds do lower blood pressure, they can also cause fatigue, dizziness, or even worsen heart failure symptoms in vulnerable seniors. It's essential to have regular checkups and medication reviews with your healthcare provider. Sometimes, newer medications with better safety profiles might be a better option, helping you control your blood pressure without putting extra strain on your heart. Remember, never stop or change your blood pressure medicine without consulting your doctor. But do make sure you have an open conversation about the risks and benefits of your current treatment. Pill number 4. Certain cholesterol-lowering drugs and unexpected side effects. Cholesterol meds, like statins, are commonly prescribed to reduce heart disease risk, and for many, they're life-saving. However, some cholesterol-lowering drugs can have surprising side effects that quietly affect heart health. For instance, while statins are generally safe, in some seniors they may cause muscle weakness or pain, which reduces physical activity. Less activity can mean a weaker heart over time. Other cholesterol drugs, like fibrates or niacin, can sometimes affect your liver or blood sugar levels, indirectly putting stress on your cardiovascular system. If you experience unexplained fatigue, muscle aches, or other new symptoms after starting a cholesterol medication, bring it up with your healthcare provider. The key is balance. Lowering cholesterol is vital, but not at the cost of your overall heart and body health. My modern and unstoppable seniors. The common thread here is this: medications meant to protect you can sometimes have hidden effects that sneak up on your heart health. That's why staying informed and having regular conversations with your healthcare team is one of the best defenses you have. Pill number 3. Certain diuretics. The double-edged sword diuretics, or water pills, are often prescribed to help remove excess fluid from your body. For seniors dealing with high blood pressure or heart failure, these medications can be a lifesaver, but they can also be tricky. While diuretics reduce fluid overload and lower blood pressure, they can cause your body to lose important electrolytes like potassium and magnesium. These minerals are essential for a steady heartbeat and proper muscle function. Low potassium levels can lead to dangerous, irregular heartbeats, dizziness, and muscle weakness, all of which increase your risk of heart complications. If you take diuretics, it's crucial to have your blood levels checked regularly and talk to your doctor about diet or supplements to keep your electrolytes balanced. Drinking too much water without replacing minerals can also be risky. Pill number 2. Certain antidepressants. Hidden heart risks. Many seniors use antidepressants to manage depression, anxiety, or other mood disorders, and mental health is incredibly important. However, some types of antidepressants, especially tricyclic antidepressants, TCAs, and certain selective serotonin reuptake inhibitors, SSRIs, can have side effects that affect your heart rhythm or blood pressure. 4. Example: TCAs can sometimes cause a fast or irregular heartbeat and low blood pressure when standing up, leading to falls or fainting. Some SSRIs can slightly increase bleeding risk or interact with other medications that affect your heart. If you take antidepressants and notice symptoms like palpitations, dizziness, or unusual fatigue, it's vital to tell your healthcare provider. Mental well-being and heart health go hand in hand, so never stop your medication without professional advice. But stay informed about possible risks. My modern and unstoppable seniors. These medications show how complex heart health can be. It's not just about one pill, but how all your medicines interact with your body and each other. That's why personalized medical guidance is so important. Pill number 1. Certain blood thinners. When protection turns, risky blood thinners or anticoagulants like warfarin, apixaban, Eliquis, and rivaroxaban, Xarelto are vital for preventing dangerous blood clots. Many seniors take these to lower the risk of stroke or heart attack. However, these medications carry a fine balance. While they prevent clots, they also increase bleeding risk, sometimes in places you can't see, like the brain or digestive tract. Unnoticed bleeding can weaken your heart over time or cause other serious complications. Plus, blood thinners can interact with many common medications and even certain foods, which can make managing your dosage tricky. If you're on blood thinners, regular monitoring, clear communication with your doctor, and understanding your medications interactions are key to protecting your heart safely. Final safety tips for my modern and unstoppable seniors: always keep an updated medication list. Share it with every healthcare provider you see. This helps avoid dangerous drug interactions. Don't ignore new symptoms: fatigue, swelling, dizziness, chest discomfort, or changes in heartbeat are signals your heart may need attention. Ask questions. Never hesitate to ask your doctor or pharmacist about your medications, their benefits, risks, and alternatives. Lifestyle matters. Medications help, but heart-healthy habits like a balanced diet, regular gentle exercise, stress management, and quitting smoking are your foundation. Regular checkups. Heart health changes over time, especially as we age. Routine screenings and honest conversations with your healthcare team are essential. My modern and unstoppable seniors. Your heart is the engine that keeps you moving, dreaming, and living fully. Guard it wisely, stay informed, and never be afraid to advocate for yourself. If this video helped you, please hit the like button and share it with someone you care about. Subscribe to Wellness for Modern Seniors and turn on notifications so you never miss important heart health updates. Comment 1 if you found this valuable, or 0 if you think we can do better. Your feedback shapes future videos. Thank you for trusting Wellness for Modern Seniors to be part of your journey to a healthier heart and a vibrant life.